We started our show today, our question of the day, actually just after 2 o'clock, by asking you what you thought about this story that came out, National Public Health Institute releasing results of a survey that shows that most of us, 80-something%, over 80%, think that there's nothing to worry about as far as COVID goes.
Okay, so 81% believe their bodies will easily fight the disease if they catch it. And the vast majority of people say, I don't worry about it anymore.
So we asked you, actually, are you worrying about it? Because, as you said, the part of the story beyond most people for not worrying about it, and that's perhaps not so surprising, is that people on the medical side, doctors, are saying the same thing, like, we're right, you don't have to worry about it. So we reached out to Dr. Matthew OUGHTON over at the Jewish General Hospital, talked to him this afternoon, a little earlier. I began by asking him about that, the fact that we're discovering most Quebecers are not worrying about COVID. Are they right not to worry? Here's what he said.
On a population level overall, COVID is clearly doesn't have the same impact now as it did earlier on in the pandemic, and you can measure that in all sorts of ways. You look at the number of beds in hospitals across Quebec that are occupied with people either because of COVID or with COVID, and even over the last 2 months, the number, which is already small, has dropped by about another 50%. But that said, when you're talking about a large population, obviously not everybody in that population is the same, right? And certainly when it comes to COVID, it's not a surprise to say that often the people who are at highest risk of getting severely sick are often, there's a big overlap between those people and the people who have risk factors for not responding as well on their immune system to vaccination or previous infection. So although overall, in the large terms, you've got a pathogen that is posing less and less of a threat against a population that is more and more immune, that same risk or reduction in risk doesn't apply equally to everybody. So I think it would do well for everybody to remember that there are still people and groups out there who remain at high risk despite their and everybody's best efforts.
So for those people who are at high risk, that group that was always the one we had to worry about the most, nothing really changes. You're suggesting they be as careful and diligent as ever before.
For sure, and of course, their job is made somewhat more difficult by the fact that the rest of society is no longer taking the same precautions. So, if anything, they need to be even more on their guard. You look at the recent NACI recommendations on vaccination, right? And the high-risk group is the group in which they're still recommending boosters every 6 months. We're in a bit of an interesting dilemma coming up to the autumn in that for people who are coming up on that 6-month time point where they're due to get another booster, we know that we are expecting a updated version of boosters to come sometime soon, probably this autumn, but we don't know exactly when. So people are going to be stuck with this. Do I get another booster of the current booster now, or do I wait it out? And not knowing for sure when it's coming, that becomes you have to make a choice, and there's no obvious right answer whether you go with the current booster, because hey, we've certainly seen in past times during this pandemic where even when there's regulatory body approval for new products, new vaccines, just because there's that approval doesn't necessarily mean instantaneous availability, right? I wouldn't be surprised if updated boosters, they're initially available in Canada in low amounts, and probably they'll be prioritized for the people at the highest risk, elderly people with multiple medical issues, living in group homes, group facilities like CHSLDs and RPAs and so forth.
Dr. OUGHTON, can I ask you about the effect of this new variant, EG.5? Are we seeing an uptick? Will the vaccine work as effectively on this new variant?
Well, so I would imagine that the updated version will probably be better than what we currently have. This new variant, EG.5 or Eris, is, there's still a lot we don't know about. It hasn't even been flagged yet as a variant of interest or concern. It's certainly showing up, both across the states as well as recently Public Health Agency of Canada put out a announcement saying that they think that it's posing now, I think something like it is now like the cause of about 1/3 of all new COVID infections. So we have at least some early evidence that it's more transmissible, but we certainly don't have any evidence that is that it is more severe or able to escape immunity or anything else. We've seen variations on this theme happen over the course of the entire pandemic. This is still another Omicron subvariant. So I imagine that eventually this will probably supplant most of the previous variants we were seeing, most recent things like XBB 1.15, things like that. But I don't think that there's any evidence to say that this is particularly more severe or that it's less likely to respond to our current therapeutics or vaccines.
So would it be fair to say in the report from the National Public Health Institute that people now react to this when asked by saying, hey, it's like a cold or a flu, I will treat it like that, and that's the end of it?
Again, for people who are not at elevated risk, I think that's going to be what we've seen people doing and probably what people will continue to do. We'll see, things have changed on very short notice before during this pandemic. I would never rule that out as a complete impossibility. That said, I think we will probably still have our hands full coming into the sort of more winter season and the sort of the so-called cough and cold season if we have increases in multiple respiratory viruses at the same time, like increases in COVID-19, but also influenza and RSV. So certainly everybody who is still fortunate enough to have a primary care physician should be talking about what they can do to prevent in terms of vaccination. There was just the new vaccine approved by Health Canada for RSV in older adults and so forth. So these are the kinds of things we should be preparing ourselves for now that will protect us both individually as well as benefit us on a population level.
Dr. Oughton, in that same survey by the Quebec National Public Health Institute, 88% of Quebecers say they would still isolate themselves, though, even though they think it's just like a flu and they believe that their body will fight the disease easily if they catch it. They still will isolate themselves. Do you agree with that? Should we still be isolating ourselves, even if we aren't testing? Because it also shows the vast majority of people aren't testing anymore.
Which is not much of a surprise because it's harder to get access to testing, both the rapid kits. A lot of people still have some left over in their cupboards, but they're not being distributed across such a wide they're not as easily available or widely available as they used to be. Look, maybe that is one of the overall positives to come out of the pandemic is people realizing that the so-called presenteeism, the idea that I have to go to work, I have to go to school, even if I'm sick with something that could be quite contagious, maybe this pandemic has taught us how to do things a little bit differently. And, I certainly don't think that staying home while you've got rip-roaring respiratory symptoms, I don't think that's a bad idea.
So, and you would obviously say that testing, you should still consider doing that as well, even though most people, as Natasha said, are failing to do that.
So, so right now, middle of August here in Quebec, respiratory virus-wise, the most common circulating virus at the present instant is still SARS-CoV-2. The rapid tests are still, most people have some access to them, and they're still reasonably useful. Okay. Yes, you can sometimes get false negatives, especially if you test very, very early. But that same concept may not apply 4 or 5 months from now when there's lots of other circulating viruses as well that can cause very similar symptoms. So all that to say that if you are very symptomatic, you should still seek medical attention because, no matter what time of year it is, we have the capacity to do sort of further testing looking to see, is it really SARS-CoV-2 or influenza or RSV or any one of the other multitude of respiratory viruses that circulate.
But ultimately, regardless, you would still, the treatment is still stay home, don't go to work, and basically take care of yourself and let the thing just play out.
Mostly, again, for people who are at high risk of bad outcomes, right, we do have specific treatments for SARS-CoV-2. We do have specific treatments for influenza. For most of the other respiratory viruses, we don't. So there still is a role for knowing what the actual cause is, not only for the satisfaction of knowing, but also because that then tells you what therapy, may give some benefit. But those are usually therapies directed at people who are at really high risk.
All right, Dr. Oughton, thank you. Appreciate your time this afternoon.
My pleasure. Thanks for having me on.
Dr. Matthew Oughton, Jewish General Hospital. There you go. Most people not worrying about COVID, and apparently neither are doctors. Although, again, to be fair, he did point out, and I think people point that out as well. Yeah, obviously, if you're in one of those groups. And obviously, remember, we're likely to see a spike in the fall like we do every year, right, for flu. Probably will happen for COVID as well, but everything seems to be, can I say okay?
The doctor said it's guaranteed that there will be a spike this fall, but he also said that it will have, like we said, little to no societal implications.
Fingers crossed.